This is actually the first interview that we're conducting as a chapter at Northern California Nigerian Nurses Association. I'm Koso Ibe, Fasaluchi Ibe Fuli. I'm the co-chair of the Communications Committee. I and Odir Maku are the co-chairs. And Dr. Ake has been encouraging us to do something like this. So we took the opportunity and she recommended that we interview you. And we're just so thankful to have the time to talk to you.
You're welcome.
Thank you. So I'm just going to go ahead and read your biography and introduce you properly.
Okay.
All right. Okay. So Dr. Iwu is an assistant professor at Rutgers School of Nursing in Newark, an APN and senior technical advisor for community programs at Institute of Human Virology, Nigeria. She currently is a Ruth Kirstein National Research Service awardee for postdoctoral fellowship at University of Pennsylvania School of Nursing. Dr. Iwu is a global health practitioner and researcher who works with nurses, community health practitioners, policymakers, educators, and interdisciplinary teams to design and implement practice updates, leadership and innovations in health system strengthening. She led the development and implementation of a national HIV and AIDS curriculum for pre-licensure nursing, midwifery, and community health institutions in Nigeria. Dr. Iwu's clinical research focuses on workforce and HIV treatment, care, and support interventions to improve access, retention, care, and treatment adherence for women, children, and adolescents, and families living with or affected by HIV in Nigeria. Dr. Iwu is a Robert Wood Johnson Foundation and Jonas Foundation Nurse Leader Faculty and Carnegie Foundation African Diaspora Fellowship alumnus. She is the chair of National Association of Nigerian Nurses in North America, NANNA, that's us, and Education Committee. She's the chair of that committee.
Actually, the first chair of that committee.
The first chair, and then also now the president. You're the president.
Now the president,
Now the president, yes. So this is an updated bio.
Yes, thank you.
Awesome. And then she also plays active leadership roles in other local and international organizations like Sigma Theta Tau and Association of Nurses in AIDS Care, ANAC. As past co-chair of ANAC's Global Committee, she helped to form ANAC in Nigeria. She's an active member of IOM, National Academies of Sciences Forum on Health Professional Education, and reviewer of HRSA, JANAC, British Medical Journal, and Nigerian Journal of HIV and Human Reproduction. Oh my goodness. Oh my goodness. Somebody needs to write a book about you. Oh my goodness. What an amazing biography and an amazing, all these accomplishments that you have done. It's just like, wow. I mean,
thank God.
Phenomenal. And we're just so thankful to have you as our leader of the national organization, NANNA. And we're just, it's so motivational. I was reading the biography and I was just like, oh my gosh, like, I guess I will start off by just asking you, like, how proud are you of yourself, of all that you have accomplished?
Yeah, well, I think it just came together gradually because of the mere fact that we migrated from Nigeria.
Yes.
And coming to the US, for me, it was an opportunity to see where nursing could be and where nurses, in Nigeria, nurses are not there yet.
Yeah.
So taking that experience and the interest to give back and help to move Nigerian nursing profession to close to where we are here,
yes.
So that was and just how God granted me that opportunity to work here and also work at home. So it kind of like there was too much to do and I couldn't say no to most of those things. So that's how it happened.
That's amazing. I love that. I love how you mentioned how there is too much to do in Nigeria. And I like how this organization, I joined this year at the local chapter.
Great.
And I've just been seeing how this organization and the national level, you guys really give back. The face shields that have been donated, I mean, oh my goodness. It's just, it's amazing how even though we are in North America, we don't forget that we are Nigerians, and it's nice to
Yes,
see that leaders like you are not forgetting that too. It's amazing.
that's right. Yes, thank you.
Awesome. So
Yeah.
I'm gonna go ahead and start with the questions, and
Okay.
I'm gonna go and ask you to tell us about your career trajectory as a nurse.
Um, okay, so I just found myself as a young girl being inspired by other nurses that were in my life. I had two girlfriends in secondary school whose mothers were also nurses at the time when we were growing up. One was very close friend. One of the nurses was a close friend of my mom. And then, I just grew up with her daughter and went to the same secondary school. So when I was growing up in my family, that nurse was really the doctor for the family doctor, because every time we were sick, my mom would call her, she would give us meds or injections and stuff like that, and we get well.
Yeah.
So I was really inspired by her. And then my other friend that I met in secondary school, the mom also worked in a local general, but actually now that I think back, both women worked in the same general hospital in my place.
Wow.
The one that was close to me, to my mom, was also a midwifery educator.
Okay.
So when I finished secondary school, my mom wanted me to be a teacher. So because both my parents were teachers. So she said, oh no, I said, I'm gonna be the first one in this family that is not a teacher. So I want to be a nurse. And of course I had my role models already. So I felt like I needed to find out more about nursing, go to school and be able to help other people like these two nurses that really touched my life.
That's
So
amazing.
now that was the first time I disobeyed my parents. So as I was taking entrance exam, I took JAMB, I took everything they entered, including nursing school. And I passed it, all the two nursing schools that I put in, I passed both of them. So I went to UNTH.
Nice.
So now getting to UNTH, my goodness, our faculty members, the principal, and then they made me the class prefect. And on the first day, my colleagues made me a class prefect without even knowing me. So I didn't realize it was once you are the class prefect or class representative, you'll be that representative for the rest of your school year there, or the rest of the 3 years.
Oh
So
wow.
I didn't know. Yes. So that was my first leadership role. And there I was born. you know
That's amazing.
yeah,
The fire was ignited.
it was ignited. So I had to behave myself. I had to be serious with my education, because the principal was a lot of our teachers at UNTH back then, they were all foreign trained nurses. So they came with an ideology of what nursing should be, very cultured. Of course, they brought the culture of Nigeria and training women, but they also infused into it that Western culture as well. So I was held to a very high standard, and I needed to lead my group with a very high standard. So that was what happened. So now my mentors grew when I got to nursing school. And from there, it just, when I finished nursing school, I did my midwifery at ENU, a hospital in Anambra. And then as soon as I finished that, my husband was here, so I joined my husband, and the education continued here. So that's how I worked a little bit in Nigeria in between my nursing and midwifery programs in Onitsha. And then came out here and continued. But I felt that I promised my parents I'll be a teacher, and because I kept telling my mom, as a nurse, you teach.
Yes.
Yeah, you are a perpetual teacher, because your patient education is part of, even if you're in clinical or you're teaching.
Yes.
So I said I'll do my own teaching from nursing. So that's how it all happened. I've held several leadership roles in different settings where I have worked over the years. But now you find, I wouldn't say that the higher you go, you're kind of moved towards education, not really. However, the places I've worked, and then I went back to Nigeria to work with this IHVN, or Institute of Human Biology Nigeria. I was doing public health.
Wow.
And because I didn't have a PhD then, I would come up with ideas for studies or grants, but I wouldn't be able to apply for them
Wow.
because I didn't have a PhD.
Wow.
You know, so one of my friends in Maryland at the time said to me, you know, you're doing the work. Why not go back to school and get the certificate or the diploma? So I went back to school for PhD.
Oh my goodness.
Yeah. So that's how now, after the PhD, I felt like, okay, so I need to be in a setting where I'm really living what I went to school to do for my PhD, being a nurse scientist and all of that. So now I started teaching in a university and all that. So that's the trajectory. And for me, I feel like no matter where you are, I always look at my goal is like 5 to 10 years. I always tell myself 5 to 10 years. Where do you see yourself?
Mm.
5 to 10 years.
Yeah.
So even when you achieve one, you also go back every year. You now go 5 to 10 years. That way you keep setting up your own goals and making it. I always feel like there's always more to do.
Yes.
So,
Yes.
so
Especially.
I told my kids the PhD is my retirement job. They were laughing. They say, "Oh, you're just the first person that will go to do PhD just for retirement." I said, no. And when I get to my retirement, you know, one thing about nursing is that you could be retired but not tired, you know. Yeah.
I love
So,
that. I love that. That is such an amazing story. And it's
mm-hmm,
so inspiring just to hear how that fire was ignited from you
mm-hmm,
seeing the
mm-hmm.
nurses in your
Yes.
life and how important their role was in your family, and
Mm-hmm,
just using that inspiration to go a little against what your parents said and do a career that you were
mm-hmm.
passionate about, and then still
Yes.
coming back and teaching and having that
Mm-hmm.
aspect of teaching in it, you know.
Yes.
Nursing is this profession that
Mm-hmm,
there's so many things to do. Even reading your biography, I'm like, I didn't know
mm-hmm.
nurses can do that. Like, you know, I'm still
Yeah.
just like so amazing, like to see how limitless being a nurse
Mm-hmm.
is. You can really
That's the joy of it. Yes.
yes,
Nothing gives you, when you look at it from a very myopic way, you can say, oh, you're just a nurse. But that's not just what you are, because you have the opportunity to diversify. Even if you want to stay in clinical, it gives you the room to become a specialist in any area. You can never say I'm broad as a nurse, because when you are not finding the excitement you want in bedside or med surg, you go to critical care, there's always something else that can excite you. You
yes.
just need to inspire yourself and challenge yourself.
I love
But
that.
if you don't challenge yourself, you could be in one area for 60 years
Wow.
and then complain about it.
Yeah, yes. You know, I mean,
Yeah.
to each his own, but I know
Mm-hmm.
definitely it's nice to see movement and how you
Mm-hmm.
just, it's like, wow, I love
Mm-hmm.
it. I love it.
Mm-hmm.
And so you're,
There's a part to it though,
yeah,
when you know, as Nigerians, we're very rooted in our religion. I wouldn't say I don't usually go by the word born again, but I feel like everything that you do and anchor it to God and always allow yourself to be guided.
yeah,
I feel like every opportunity is a way God is trying to use you for a purpose. So
yes,
that's always my belief. So just being open to
yes,
be guided by God in whatever area. So even if one door closes, another window opens,
yes.
and there's an opportunity to make it an open door.
That is amazing. That's really, really, you know, encouraging to hear that, you know, especially
Yeah.
me starting in the beginning of my nursing career, just to
Mm-hmm.
hear, you know, because maybe sometimes that job you wanted or that opportunity or this thing that you wanted maybe didn't
Mm-hmm.
look, it didn't work out, and you know, you
Yeah.
thought it would work out, but then maybe something
Mm-hmm.
else will come and God is open.
It's not the time yet. That's it. It's not the time. Don't burn yourself thinking, oh my God, I failed myself. No.
Yeah,
The answer is that God says that's not the time yet.
awesome.
Don't leave that, because he has something bigger in front of you, but you don't see it yet.
Definitely.
Mhm.
That's
Yeah.
amazing. And what professional nursing role do you have now?
Well, right now I'm an assistant professor at Rutgers, and this month my I so because of COVID, my school is not hiring or promoting right this year. However, towards the end of last year, there was an opportunity. Our assistant dean in charge of the global health office was stepping down, so the position was open. So I applied, and I was about to get interviewed, and then they said they're not hiring or promoting people. So, but still, the dean asked me to step into the position. So this month, I'm now directing our Office of Global Health at Rutgers School of Nursing.
Oh
Yeah.
my goodness, that's amazing.
Thank you.
That's
Thank
awesome.
you. So, but I still teach.
Yeah.
I teach community health. I was teaching like pharmacology, but community health is community health nursing
Okay.
is what I usually teach. Yeah.
And you mentioned COVID, so maybe we can talk more about the pandemic and
Mm-hmm.
what your experience has been like as a nurse during this pandemic. Maybe doing your roles that you have now and seeing
Mm-hmm.
how COVID has affected it, and
Mm-hmm.
just how your overall view of nursing has been affected by this pandemic.
Yeah. There are two folds to that part. As the president of NANNA, we had in mind that our strategic plan was to have our conference in Nigeria this year.
I'm gonna go.
So,
I was
yes,
I was so excited.
yes, I know. So yours truly, when part of my job in Nigeria is that I spend 50% of my time in Nigeria working for Institute of Human Virology. So my trip in February was actually to go, and I was implementing an adolescent peer support program at many of our clinics in Nigeria. However, while I was there, I was just doing a lot of engagement with policymakers and people that we needed to get on board, nursing organizations. And, I wanted to bring all nursing organizations and all everywhere nurses worked, including military, paramilitary, and anywhere. So I wanted to bring nurses because we felt that 2020 is the year of the nurse and midwife, and Nigerian nurses in North America we were coming home. So what I was doing was putting together, from end of last year, we inaugurated the planning committee. So we got Federal Ministry of Health Nursing Division, we got the National Association of Nigerian Nurses and Midwives, and Nursing Council. So we put everybody together. They sent me representatives, and because it was happening in Abuja, I insisted on having representatives from the Federal Capital Territory. That's how we formed our team. So I went home in February and just to bring nurses, and we wanted to celebrate nurses.
Yes.
So in the midst of that, now COVID happened, and here I was already in Nigeria. So I refused to get back on the flight when they warned everybody to go back to US because the borders are going to close. I'm like, hell no, US doesn't know what they're doing. I don't want to be on a 10-hour flight and then get back here with COVID for my family, So I refused to get back on a flight and come home. But, now COVID happened. What happened with COVID now is that we had this platform that we formed since October, and we were meeting every month and planning the conference. So now we converted part of that platform to engaging nurses in Nigeria through the nursing organizations to work with NANNA. As for instance, Dr. Grace was in the epicenter in New York. So, and Dr. Grace was running the planning committee with me, So we decided we use the platform to bring ideas from US, especially New York, where it was epicenter. As the clinical standards changed for care and everything she was doing, we were educating nurses in Nigeria through the platform, So we did that, and every time we met, we did updates from US, update from Nigeria. What are you guys doing? Can you think about this? Or you guys are not doing that yet. Consider this because this is our experience. We were sharing experiences. So we were also advocating for nursing to be brought to the table of decision making. We were encouraging nurses, every director of nursing, to make sure that in their state they're taking leadership in making sure nurses are protected and educated to manage COVID. So we kind of use that platform to ginger our teams on the ground. So, but over here, we needed our members. We're scared to death. Some of them wanted to quit nursing because of COVID. You can feel you can palpate the fear and anxiety levels in nurses at that time. So Dr. Grace called me, I need to run a support group. She said, I need to run a support group, a daily support. I said, Dr. Grace, when do you find time to even do that? So she said, no, they need it. Especially in New York, and our nurses are very scared. So she started. Every day she'll do a 2-hour. And then about 1 month into it, a few weeks into it, we had a meeting, and then we said, you know what? She said, everybody was like, how do we multiply this? Because people were calling in. Yes. So we said, okay, the board will help her. Let's all divvy out the days, and one of us will run the support group every day. Yes. So that support group is still going. Oh, we're just getting ready to wind it down. Yes. So supporting nurses and, you know, feeling the pulse and things that were coming up in the sessions. We kind of felt, okay, so we needed to do a webinar, things like mental health. We needed to talk about, you know, so whatever the issues are, we now address it at the global level. Yes. Because if nurses from New Jersey or New York are saying it, other nurses in other areas are also feeling it, you know. So that's one of the things we did. So we realized also that many of our nurses, you know, Nigerian communities were very private. We don't like to talk in public about our personal business, you know. So many nurses who became infected were not coming out to participate in the support group, you know. So having worked in HIV for many years, I called Dr. Grace and I said, this is something similar to what we went through in HIV because of the stigma attached. So I was also calling the nurses privately, and some of them are telling me when they told people that they were infected, you know, they were stigmatized. One of the nurses said to me, my name is no longer that name that I have. It became the lady who has HIV, the lady who has COVID. Wow. That was how So because of that, she shut down. She wasn't telling people. She wasn't sharing her experiences. So she couldn't really, so it became more isolating to even have COVID. So I told Dr. Grace, there are 2 things I would like to introduce. Mm-hmm. Private support group, you know, whereby only those who have had it but have survived can help us to support other people who get infected, but they don't want to come out to group line. Yeah. So we started running that one. Well, I still have a support group where those who are infected will come in. They don't want to come to this general support group. So we have somebody calling them and interacting with them privately. Wow. Then the other one was luckily we have not lost any member yet. Okay, However, we have some nurses who lost their husbands, their children, you know, people lost family members. So I started that other support group for bereaved families. Oh my gosh. So that one is going. So coming back to my own role, I was teaching my community nursing clinical. My weekly conference is usually it's online. So my trip to Nigeria, I was still teaching it. I situated my students here before I traveled. So now, getting down to Nigeria, I realized that, oh my goodness, with COVID, my students were coming back to conference each week and talking about their experiences. Can you believe sometimes when I usually have an icebreaker at the beginning of class, every conference time. However, this time around, my icebreaker was like, how are you all doing? They're all in New Jersey, in the northern part of New Jersey, close to New York, the epicenter, and the numbers were equally getting higher and higher in New Jersey. So this was an RN to BSN group who were also in their own employment in the front line. Okay. Yeah, so they will come to class very tired because our conference holds in the evening. Okay. So many of them will come straight to work and they'll join class. Yeah. So how are you doing? And I started hearing from them in terms of no PPEs, the same issues from our support group. No PPEs, the anxiety, the fact that they are so exhausted, the patient level, no visitors. They are now playing the role of the family for patients. It was just emotional exhaustion and fear and anxiety protection and fear of contagion. So I was hearing the same thing. So I started running my own support group in my class. So the question about how are you doing, tell me, because I needed to calm them down before class so that they can refocus and really engage, So that area also, some of my students became infected. Some of them were symptomatic, and their tests were still negative. So you can feel that you needed to help them, kind of touch them in a personal way. Just it's no longer like a faculty student relationship alone. Right. I needed to so they opened up. So I got introduced them to what they can do at their facility level to help themselves, and taking time off, and how to reach out to the university support system, so that those emotional and mental health issues had to be addressed. So, but as a faculty, I needed also to adjust my class, because this is a clinical class. They have to meet their requirements. I'm only about 2 or 3 of them were not graduating that semester. The rest were graduating. So I needed to help them to be able to get their hours and not be held back because of that. Yeah. So we adapted class to meet their needs. So those who were working doing clinical in the health department, so anything they did with COVID in terms of screening, in terms of follow-up or contact tracing, or feeding people with masks through the employers and all of that, we kind of converted those to clinical hours.
Nice. Oh, awesome.
Yeah. So those are the roles I've done for the way my own responsibilities kind of got shaped by COVID.
COVID has impacted almost everything,
Oh,
it really has. It's ingrained in everything now, and even in our organization at the national and local level, it's ingrained in it. Yes, the numbers are going down, and the curve is bending and everything, but even as the second wave that we're seeing,
we're preparing for.
Yes, we I hope that, I think we're more prepared now, and NANNA offers us a lot of support and a lot of options to we're always receiving messages through our president, our local president, about how NANNA is supporting us and just checking in on us. All these messages that you and your team send. It's really nice just to have that support, because it's affecting all of us. Some people have lost people, and it's just great to have that support.
Yeah. Really, so at national level, so we started engaging the presidents at chapter, and then we asked our chapters to do things, in terms of call your members, divide on your members, and have each person check in on members, to make sure that everybody is fine, because each state we were affected somehow. And again, like I said, Nigerian nurses, we are still Nigerians. We don't like to ask too many questions, and as foreigners, sometimes when you ask questions in the workplace, they may think you don't know what to do. But we are one of the smartest groups of people. But people put you down because you just want to know. And because of it, some of us shut down. We don't ask questions, and so we kind of take those anxiety and internalize it, and it affects our work and our family. So we needed to fill that gap.
One thing that our local chapter president, Dr. Eke, has done is we have a COVID debriefing line mimicking your guys' support line at a local chapter too, just to support people at the local level. And so
that's great.
Yeah, it's just we're all just trying to adapt and support each other, and hopefully, by God's grace, this next second wave will not be as bad.
We're praying and keeping our fingers crossed. I think yesterday on the support group line, what we talked about is preparing for the next wave, and what we should be doing. Be part of your hospital leadership team, and make sure that you're speaking up in terms of having enough PPEs, and also preparing yourself on a personal level. Now that we're opening places, make sure that you have hand sanitizers on you all the time, and wipes, so in case you can get to a restaurant and you just wipe down before you sit down and start touching things. Just that personal preparation at personal level and at employment level. Very important.
Yes, and I think I think being the year of the nurse and the midwife, we're seeing how important the role of a nurse is, especially
Yes.
in this
Yeah.
pandemic. Nurses
Mm-hmm.
are so needed and so
Mm-hmm.
flexible,
Mm-hmm.
be at the front line in different aspects. Even if it's not in a hospital, they are
Mm-hmm.
behind the scenes too, creating these
Mm-hmm.
policies and rules and the
Yeah.
leadership. Yeah.
Mm-hmm. Yep. And speaking up, I think this year has taught nurses, no matter where you are, you really need to speak up and advocate for yourself in terms as a nurse,
Yeah.
because you know what usually happens. I think we were planning for a big bash in Nigeria for nurses, but guess what? That big bash happened with COVID,
Yeah.
whereby people realize that the nurses are valuable at
Yeah.
every point in healthcare.
Yeah.
And but again, we still find ourselves, striving to make our voices heard.
Yeah.
Yeah.
Mhm.
So
Definitely.
uh, I remember seeing some numbers of those who were. By the way, we lost one assistant director of nursing in Lagos University Teaching Hospital. I just saw a post on that today. So
So
um, in Nigeria, for instance, they'll start posting number of healthcare workers who were exposed, positive, hospitalized, dead. So all of a sudden, I started seeing numbers without nurses, and it was only doctors. I'm like, hold on 1 second. I said, you need to juxtapose these numbers with all the other healthcare workers, because I pushed for that, because I wanted them to do it and see how many nurses were in the front line and how many of us are being exposed, you know because they separate the numbers sometimes and just talk about doctors as if the life of a doctor is more than that of a nurse. But guess what? I pressured for that to happen so that the Nigerian healthcare system can notice how many nurses are exposed.
yeah.
That number would be more than the doctor numbers.
Mm-hmm.
And then luckily they haven't lost anyone. It was just this morning that I woke up and I saw a nurse died from COVID in Nigeria. So far, here and at home, we've been very lucky, and we thank God for that. Later, we are going to now count. Right now, we are still in the front line, and we're still in the war front. But I think by when everything settles down, we will now begin to count our miles. We
Definitely.
haven't counted it yet, so yeah.
And I would love to transition to talking about Nigeria, since you're very involved, as you were mentioning just now.
Mm-hmm.
You're able to
Mm-hmm.
advocate for them to count the number of nurses who are affected
Mm-hmm.
by
Yeah.
COVID. So you are so ingrained in Nigeria,
Mm-hmm.
in so many ways and different aspects. Can you tell us
Mm-hmm.
a little bit more about the training that you're conducting in Nigeria, or any projects that you have besides the ones that maybe we have mentioned already? Anything that you're doing in Nigeria that is just, your passion project, or anything that is your profession. I know you mentioned a couple already, but is there anything?
Mm. Yeah, so the Institute of Human Virology, I've been working with them for many years, from the early years when we implemented HIV care. My role transitioned from just training nurses and other healthcare workers to provide care for HIV patients, because we went from a time when we had severe stigma among healthcare workers because of HIV, fear of HIV. And now we're at the point where nurses are no longer that they're not afraid to care for patients. However, we need to go back and look at the quality of care.
Yeah.
So a lot of what I'm doing now is to help the program to evaluate our services and look at the quality of care being provided. So we noticed that um, what we have been doing over the years, we have done very well with adult patients,
Mm-hmm.
but we also have pediatrics. In Nigeria, we have either pediatric and adult, but there is an in-between level of care or in-between population where the pediatric patient grows up and nobody actually focuses on that. They talk about youth-friendly services, but that's really lip service. Because when you come to the facilities, you at the outpatient department, you have adult care, and the outpatient department you have pediatricians and pediatric clinics.
Mm-hmm.
So there were a lot of the hospitals didn't have anything about adolescent care. So, but again, you realize that in HIV, the adolescent, many of the most infections happen among the adolescent population. This is a global figure, and then why are they more exposed? Plus now Nigeria had a lot of children that are now growing up and becoming adolescents and going into adult care. There's another thing that we realize that the care we give in pediatrics, a lot of our caregivers or parents are not disclosing HIV status of the children who were infected as children.
Right.
So now we are expecting those adolescents to transition to adult care.
Right.
But they still don't know that they have HIV.
Oh, the
So
adolescent doesn't know?
yeah. And guess what it does to the adherence to antiretroviral therapy is that, okay, so now they know they've been taking meds, and you can tell a child, come here, I'll give you your medicine, and then you stand there and give them the medicine. Over time, they will transition to, okay, here, take your medicine, you give it to them. So we, at the beginning of the quality improvement program, we did a focus group for the adolescents in care. And then we did a focus group for the caregivers. So the caregivers are made up of, some of the children are orphaned. So it's made up of caregivers who were either positive or not positive with HIV. So those who are not positive with HIV have not benefited from the education about taking care of themselves with HIV. So many of them were afraid of the questions that the adolescent will ask. Right. And you know, the adolescents are growing up, they're experimenting, they're still normal adolescents, they're trying out, you know, having boyfriend and girlfriend and stuff like that. They had a lot of questions. Yeah. And then they have to balance it with, oh, I'm going to hospital every month to get medicine. What is this medicine for? And they'll be asking questions, but they will usually tell them, oh, you have this blood disease. Wow. Oh, you have malaria, or they give them, oh, you have to take this medicine for, you know, they just call it a name that is not HIV.
Oh my goodness. So the adolescent is now transmitting it.
Yeah, yes. So they are getting into relationships. They don't know that they have HIV, or you give them the medicine, but they're sick of this medicine. They're sick of taking it every time, and their friends are asking questions. Why do you have to go to the hospital every time, but you don't look sick? What's wrong? So those questions. So they all came out in our focus group, and even the caregivers were like, "Please help me. I need to tell, but I don't know how. I'm afraid she will ask questions or he will ask questions, and all of that." So that has been my project in Nigeria for the past 3-4 years. It's really helping the adolescents. We train some of them to become peer educators at the clinic. Wow. Working with their peers, and then we're helping the caregivers to coach them through other caregivers who have successfully disclosed. We kind of have a forum for them to help them to disclose, and the healthcare workers now will support them. You know, sometimes they'll say the pediatrician or the nurse should disclose, but what happens if you don't prepare the caregiver at home? Mm-hmm. So during a 15 to 30 minutes encounter with the patient and the caregiver, you disclose. But the adolescent now goes home. Yeah. You know, majority of the question will be at home until the next visit. Yes. Yeah. So that's still a gap. So I recently submitted a grant to help us support caregivers in kind of helping them with that role of disclosure. And supporting them to gain skills in terms of answering those many questions that the adolescents have. Oh, wow. You know, so when I get grants, it helps me to train healthcare workers. It helps me to also get in the community to do those services that are not funded by the government. Okay. You know, you will know that this kind of thing is not funded by the government health system in Nigeria.
No, I was just gonna ask, like, where do you apply for that grant? Who is giving that fee?
You scout out for the grants. The last one I applied to is a National Institute of Health, the Global HIV Program. You apply there. Sometimes they have a request for funding. You have to look at what fits what you're doing. You have to tailor it to fit to what the funder wants. And so the grants are everywhere. You can actually get small grants from Carnegie Foundation. Well, Carnegie Foundation also, they're doing the diaspora things, which I've done once, and I actually got another one to go. That one it was actually HIV related because I used it to help the faculty to also know how to teach HIV program. However, funders include Bill Gates Foundation. You can even get like Microsoft or Google grants for M-Health in HIV services. You just need to look. You just need to look. And I think as socializing with faculty members who are doing research also helps you to know where to look. And how to, I learned how to write. I'm still learning how to write grants.
That's amazing.
During my postdoc.
Yeah. So Nigeria does not support the work. I mean, financially, the federal government, they're not the ones who will support with the finance.
Well, over the years, the Nigerian government has put in money, and it actually came from pressure from donor agencies. Before, a lot of the HIV money for treating patients, for buying the meds and everything, and other support services was coming from donors like President's Emergency Fund for HIV or Global Fund. They were all donors. So over the years, those donors pressured Nigerian government to put in some money. So right now, Nigerian government is paying for a lot of the medications, what we call the front line, the first line medications, is being supported by Nigerian government money. So then when the patients fail the therapy, and then we have to move to second line or third line medication, those ones come from the other funders. But a lot of the community, in Nigeria, it's not like you have insurance here and it pays for several things in your healthcare. In Nigeria, it's not like that.
It's expensive, very expensive.
Yes, so many people pay for what you give them. A lot of the community-based services where I find myself many times going into community, running support groups. They fund support group for them to come to the meeting, and that one over time has dwindled again. But a lot of what we do, like I'm talking about disclosure support, those are not funded, part of care. There are a lot of things that you want to do, you have to find money to do them.
Right. And if I'm not mistaken, if this is still correct, Nigeria has the second highest rate of HIV in the world, second to South Africa, right?
Yeah, and if you look at we have the highest numbers of pediatric infection.
Wow.
Our prevention of mother-to-child transmission is still the weakest globally. And so let's say the current number of our coverage for pregnant women who are living with HIV, covering them with medication so that their viral load is suppressed and so that they don't transmit, is about 43% coverage.
Wow.
So that's a big gap, knowing that we're still going to have babies born with HIV when many countries are not even having one.
Right.
So that's where we are. Wow. So in terms of other things I'm doing, so I'm working with adolescents and their caregivers, and bringing these services is still looking like we're still in the 1990s of adult HIV, because a lot of the care providers in the hospitals know that the gaps are there, but oftentimes they don't have the capacity that is needed to be able to. So we advocate for the money to come and do a specialized services for the adolescents. Wow. Special clinic day, focusing on forming their support group for them, where now they can share their experiences together, not sit in the adult support group and not be able to speak up,
right,
and ask questions. So that's what I'm doing.
How do you guys battle with discretion and confidentiality in those focus groups with the adolescents or the adults?
Oh yeah, it's a fine balance. I know my first focus group was both those who have been disclosed to and those who have not been disclosed to. We usually seek permission from the caregivers, and they're always like very fearful that during the focus group we would disclose, but no, we don't do that, And of course, the adolescents who are there, they're very smart. They will try you to tell them exactly what they have, So, but you have to. The peer educators, what we do with them is we talk to them about the fact that they're not the ones that are supposed to disclose. They will be the ones to support their peer when they are disclosed to. However, the caregiver and the healthcare worker needs to be the ones. So the questions will come up, or the first focus group, one of them said to me, Auntie, why do I take medicine? And this was in front of everybody. So the nurses that are running the focus group with me, they were like, so they are, you can feel their pulse like palpitating on their chest. It's like, so they said, okay, so we'll let Dr. Iwu answer that question. And I said, so you have to be careful. I said, okay, so you know that you just met us for the first time today. And we really don't, we are not the healthcare workers here. You know, you have a doctor here, you have a nurse here. And I think that question, we don't know what medicines you're taking and we don't know what it is for. However, I think the best person to answer that question, so you have to be clever about that, because you have built trust. For them to open up and ask that question, they trust you.
Yeah.
And you don't want to erode that trust, but you want to make sure that you anchor their trust in a way that they feel satisfied with your answer. You know, so we kind of deflect those questions, you know, very intelligently, so that you don't disclose to them, because you can actually, it can be a traumatic experience if you do that in that forum. So it's a fine balance, and we train the adolescents, the peer educators, that once you ask the question, hi, how are you? I know you come to clinic. Do you know why you come to clinic? Are you taking any medicine? Do you know why you take the medicine? So those are our screening questions, always, to kind of identify whether they're disclosed or not. And then we handle the rest will follow from there, because we train them on how to address those issues.
Wow.
Yeah.
That's amazing. That's amazing. How does it feel to give back to?
That's the best part of my life. As a nurse practitioner, I work here, and I used to tell my students that, you know, when I work here and I see patients who come and tell me that, hold on 1 second.
They want their mom's attention. So we'll just wait for her. She's attending to family.
Hi, so sorry. My grandkids are here with me.
No, it's okay.
Yeah, so
I know this interview is going a little longer. I know I keep asking questions. I'm so sorry.
No, it's okay. I saw your questions, but it's like, oh, that's more than 1 hour. Okay, but no problem. So in any case, we were talking about giving back. You know,
as a nurse practitioner, you have a unique position.
Yeah. So here you go to clinic, and our patients are always making noise, and it's like you're begging them to receive care. Sometimes you're calling people to come to appointments and they don't come, and you know, we put all these things in place that, you know, our patients take for granted. But when you go home, you realize that people don't even have money to buy medicine. They're begging you for money to go home when they come to clinic, because they don't have money for transport. You know, it's very touching to be able to care for a group of people who really need help, who really need care. And they get it, and they're happy, they get well. Some of them pray for you. I still feel like a lot of the blessings we have as nurses is coming from our patients. They're praying for us to God, praying for us to have all these things in our lives. You know, so it's really touching. I'm working with nurses. You can actually see in front of you the level of care changes. You know, when you work with nurses and other healthcare workers, stigma went down very, very much, and we made a lot of nurses and other healthcare workers as advocates of patients living with HIV, from a point where they were discriminating against them to a point where now they became the advocates, and they were educating other healthcare workers or communities about reducing stigma. So there's a lot of gratitude. You give gratitude to God for the opportunity to do that. You know. Yeah. The joy of working with nursing in Nigeria and changing their view of care, you know. I tell my colleagues in Nigeria sometimes, I said, you need to treat patients very well, because it's because of them that you're here. They're not paid by the hour like we are here. You know, many of us here, our units will send you home if they have low census. In Nigeria, they're paid salary. So they come to work, get paid whether patients are there or not. But I tell them that you have a job because a patient is coming to the hospital. So you need to treat that patient very well and say thank you. They look at me like, are you nuts? You know, yeah. So I used to go to hospitals, and if I find nurses who are really very rude to patients, I will call them aside and talk to them. And I used to hear things like, oh, I'm not the one that gave you HIV, so please don't, you have to behave yourself. You know, being loud and talking like, yeah. And these are nurses. So over time, things like that will change because you have educated them, you know. Yeah. So the other thing I'm doing in Nigeria is also, right, this year I'm studying a grant that is evaluating a type of midwifery education that the Nursing Council implemented. In the northern parts of Nigeria, especially the conflict-affected areas, many of the communities don't have trained midwives in the primary health centers. So this, about 3 years ago, the Nursing and Midwifery Council approved what they call a community midwifery program. We are in the community, and this is a collaboration with communities. The community leaders will identify young women, young ladies from the community who they think that can be trained as a midwife at a school, and then they'll come back and serve in that community. So this program encourages the primary health centers or the local government to hire these young women. And then they would send them to school. They train them. The program is about a 2 years program. And then when they graduate, they come back to that community health center and work for the local government.
That is awesome. So that's
so I'm helping the Nursing Council to evaluate that program for the next 5 to 6 years.
Wow. Yeah. And you guys are using benchmarks to.
Oh yeah.
Okay.
So we're comparing their competency level. We're going to compare the curriculum, the cost of education, and we're going to look at how many of them go back to that community to work. Are they retained? Okay, so we're doing this in Yobe State, which is next to Borno State, where we have the Boko Haram issues. Not only are the communities hard to reach, sometimes geographically, there are also conflict-affected areas where once in a while there's shooting and people like leave their homes, and many people have displaced camps where people run to. You know, so we're going to be looking at these midwives where they're supposed to be when they graduate. So we follow them for 5 years, and we're going to track retention. And what kind of support services do they have on ground to help them to stay? Wow. So so that's my work for study in Nigeria.
Yes, please keep us posted.
Sure.
Just to conclude, I just want to talk more about NANNA and a little bit about what NANNA is doing professionally.
Hold on 1 second again. I'm so sorry. This working from home is not working for me. Oh my God, so sorry.
Sorry to your family. I know I'm keeping you. We're almost.
No. It's just they're living their life.
They like having mom at home.
Yeah. So you talked about NANNA, right?
Yes. I wanted to talk more about NANNA and just the future, and I guess specifically one thing that I saw was the joint statement that NANNA and the Nigerian pharmacists and
the physicians.
And then the physician, how you guys gave a joint statement. And so I was interested to know what are the future interprofessional ways that these 3 organizations will be partnering? You guys have any planned?
Yeah. Okay, so one thing I can tell you about NANNA is our organization brings together a lot of nurses with similar desires, similar goals. So I'm not just, if I'm speaking about myself, about the need to give back. Yes. NANNA multiplies Dr. Iwu several times. So, and that's what makes us like it looks like we are working well together, because you see, every one of us has that same goal. Yes. So recently, diaspora office of the Federal Ministry of Health, the previous minister started like what they call diaspora health initiative, and they started with the medical group, and then they realized, okay, so every time they go on missions, they're looking for nurses to come with them. Then the diaspora desk officer, Dr. Lowu, who comes here, and I'm sure if you've come to our conference, she comes to our conference every year. So she included the nurses and also the pharmacists. The minister wanted to do an initiative that brought all of us together on ground at the same time to engage our professional groups at home. So now we were supposed to go home in January, and in the midst of that, the current minister wanted to cancel it and wanted to relook at that project. And they just reconvened us again to kind of start planning. However, that initiative brought all of us together, and we have not really worked well other than inviting each other to conferences. That's all we have done. But because of that initiative, the medical group approached us last month, and they wanted us to start working together on research, to form a collaborative to work on research. So that is a futuristic plan right now, and it's just going. We met about twice already, and we're going to meet again and look. Right now, we're going to look for grants to apply for together, you know. So we're looking at working together on that. That health initiative to also improve care and work with our colleagues and come together at the same time in Nigeria is also still in sight, because we just the minister about 2 weeks ago, last week, he re-inaugurated the group. So we're going to be working together again in terms of engaging on clinical care, because people come and do surgery, people come and we do our medical mission. We're doing things separately, but we need to come together as a group to engage the interdisciplinary team on ground. So those are some of the things we're working on.
That's awesome.
The medical group called us together for that statement, and everybody, if I may use the president of AMPA, which is the medical group, sent out a text message. We need to talk, come, and everybody, all of us came. And she said, you all answered yes when you didn't even know why I was calling you. And that was how we we talked about the statement, about what's going on and the need for us to really speak out about it. Having even experienced we haven't experienced it to the extent, but we have been victims of racism. So we needed to.
Just for some background, we're referring to the statement. It's like a unity type of statement. That, NAPSA and ANPA and NANNA. NAPSA is the pharmacists, Nigerian pharmacists in North America. ANPA is Nigerian physicians in North America. NANNA, of course, is Nigerian nurses in North America. Gave a joint statement about the social justice issues that we're experiencing in America, around the world, and it was a very powerful statement. I'm going to attach it when I share this video so people can refer to it. But the press release was very moving. And I didn't want to cut you off, but I wanted to give some background on what you were saying about the statement. So I mean, I think it was just powerful to see how Nigerians can speak on this issue, because even though we are Nigerians, we still have black skin, you know, some variation of it, and have experienced a lot of what African Americans in America have experienced. So it's nice to know that professionally you guys took that stance to say, hey, we are part of this issue, and we denounce what is happening, and we are here to speak up, you know. And I think that was very moving, very, very moving. You know,
thank you.
Well, anyway, Dr. Wu, thank you so much. I know this interview ran a lot longer. Maybe we can close off. We are trying to just compile some messages of hope that like you can give about that you have for the future. So what is your hope for the profession of nursing? Maybe you can start off by saying my hope is, and then just finish however you would like.
Oh, thank you. First of all, let me say thank you for this interview. I really appreciate what the Northern California team are doing. I tell Dr. Eke, I'm really impressed with the way she's bringing all of you young nurses and older nurses together and inspiring you to do things like this. So my hope for nursing, my hope for nursing profession here for NANNA, our goal is to make sure that we are an umbrella organization that have both older nurses, I say like more grown nurses and very young nurses, encouraging, making sure that we have something of value for the younger generation, so that when you guys join us, you can say, yes, this is a group that they have something for me, as well as something for those of us who are becoming more senior citizens, you know? So my hope for nursing is that we take the COVID-19 experience and what it has done for nursing, that we always ask ourselves what's next. Because it's one thing to throw us in the limelight of health services, but we also need to know what do we bring to the table and how can we remain valuable at that table to make sure that there's something that we're giving back to our consumers of care and also our colleagues. I'm hoping that as our relationship with nurses in Nigeria has really expanded this year because of the conference we were planning, my hope is that we will continue that relationship and continue to inspire nurses. One thing I see about our relationship in Nigeria is that nurses in Nigeria look up to NANNA. We have been working with Student Nurses Association. At the meeting, at one of our meetings, they said, oh, we are very grateful to NANNA for even thinking us worthy enough to be at this table. Because they felt that at home, no other nursing organization does that to them. For us, we're looking at the next generation of nursing. It's our duty to make sure that we think about students who are in high school, students who how do we attract the next generation of nursing? It's not a good thing if you become the last generation in nursing. So we want to make sure we grow ourselves.
And nursing is such a respectable profession, even in Nigeria, where maybe the pay might not be as nice as it is in the US or other places in the world. Like, it's a lot of people, especially young women, when they're growing up, they will become nurses in Nigeria.
Yes. However, one thing is that we want to make sure that the older nurses, because of our attitude and maybe because the work environment there is not helping them to grow and be able to encourage younger ones, that they don't take that for granted, because young nurses want to be young children or young girls or boys. Actually, there are many boys now who are doing it. They want to become nurses, that they don't kill that zeal because of the way we are frustrated. A lot of this comes from frustration of the work environment, you know. So, but let's not take that for granted. Here we are recruiting high school students. In Nigeria, they don't go to high school to say, come and be a nurse. They don't do that. But let them not take that desire to be a nurse for granted, because at a point they will have to go looking for them if we are not very careful. So we want to make sure that we part of what we bring to the table in Nigeria is also for the older nurses to remember their responsibility as role models. So NANNA has been that role model, and my hope is that we continue to be that. Thank you so much.
So encouraging. Oh my goodness. Like I'm so thankful for this interview. I learned a lot, and I think sharing this with our chapter and hosting this is just going to be able to reach a lot of people who are inspired as well. Thank you so much. We really appreciate it.
Thank you. I'm so impressed. Thank you so much.
Thank you
for giving me the opportunity to talk to you guys.
We hope to talk to you again soon.
Sure. Thank you. Anytime.
All right. Thank you. Have a good day.
You too. Bye-bye.